Um, as I mentioned, my name is Ruben Viera. I'm a software engineer, but also I'm a passionate about interoperability, and I would like to share some of my. We've seen some of the definitions of interoperability today, and one of the main things that we need to understand is FHIR or fast healthcare interoperability resources. It's a standard that it has multiple ways that it's going to make easy the sharing of information. So one of the main components of interoperability is a patient. So we all are patients. So in every single patient, in this definition of interoperability, I like because it's more humane and more that we all can relate, and it's going to help providers also to as the previous panelists were talking and answering the question if the providers are going to be show any resistance on FHIR and interoperability. I think they will not, and as long as everybody understands that we all are patients, we all have a story to tell, and the more complete that story is, the better the care that the healthcare professionals can give to us. So, as healthcare professionals, we all are responsible to tell that story, and that's what interoperability is. It's a way to share the story of that patient. So the next person that is going to look at this patient or see or treat this patient is actually have all that they need and all the information to better care for this patient. So when we talk about interoperability, the first thing that it comes to my to my mind is not just standards, technology, or other things. It's more about a patient and how impactful is to have access to the right data at the right time. So to me, interoperability is that. It's the ability for us to share a story and to share a story complete because that's very important. Um, we previously we talked about some of the drivers in interoperability in the U.S. market. The biggest driver for interoperability has been regulation and regulation from government and from the industry. And we started on 2019 with what we call the federal interoperability efforts to actually promote and implement interoperability. So in 2018, there was a draft of the TEFCA, which is one of the government uh, entities that actually is promoting interoperability. And then so on, 2019, we start working with uh, some of the rules that I'm going to show you in a minute. And it has been since every year we've been taking steps into the interoperability. In 2021, every single EHR in the United States had to have implemented FHIR. So today, all ONC certified EHRs are already utilizing FHIR. So, and so on, we have been implementing some of the rules that we have at this moment. So, in a minute, I'm going to show you where we are at and where are we going. So, today, we have the CMS Rule 9115, which is this rule basically required all the Medicare, Medicaid health plans to implement what it's a patient access rule. So basically, what this rule says is you have to allow third third parties or developers to uh, build applications and connect to the health plan data or to the patient's data in the health plan in a secure way, but using FHIR as the main uh, as the main framework or standard to 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 um, to transfer and to transmit data. So we've been working since with the patient access rule, final rule. We've been working personally or for the last 3-4 years, and it has been a challenge, but also it has been very satisfactory too, to see how we have made so much advance in the implementation and giving access to other people to data. So today, this rule, what it says is the patient needs to have access to, first, their clinical information that the health plan already have, and two, the financial information. So interoperability is not only clinical data, but also financial data and some other data that is relevant for that patient to care. So that's the rule that it was finalized in May 2020, and we've been interoperable at that level since then. But then there was some gaps and some other things that were needed for us to continue growing and promoting interoperability. So that rule allowed, that previous rule allowed us to share what was patient data access, but also has a provider directory, and also allow you to share some of the USCDI, which is another of the standards, and I'll mention it later when we talk about a little bit more about FHIR. So there's a new rule, and there was one of the parts of that rule in 2020 that require health plans to also send the data from the health plan uh, to the new health plan. Let's say that I am a patient, I got a new health insurance, I go to the new health insurance, all that information need to be shared with them. That rule wasn't too specific, and it created a lot of issues. And all the healthcare providers were there was no definition of what the standard was going to be used. So they proposed a new rule, and this rule is the 0057 rule. This rule, what it is telling, okay, if you're going to share the data from one health plan to the other, which is the payer-to-payer data exchange, so you need to share it using the same standards that you use in the implementation guideline for the patient data access, which is FHIR and USCDI, and some other of the standards, and we will talk about that. But not only they requiring everybody now in the health plan and the payer side to implement that part, which is the patient access, provider directory, and the payer-to-payer data exchange, but also now they are requiring the health plans to implement, or the health insurance to implement, a provider access API. So not only the patient will be able to connect to their healthcare data using a third-party developer application, but now the provider will be too. So this is great, because now if I go to the doctor, and I consent to share my data with my doctor not only is going to see the data that he has in his EHR, but he's also going to be able to see the rest of the information, the rest of the story, and that is great. That's definitely going to have a great impact, significant impact into what is the care of the patient, to improve the patient care, the patient care. So there's other standards that are coming with this rule. The payer-to-payer data exchange now is required. The FHIR is the standard. So that's why we were going to talk about a little bit more about FHIR in the end, because what is common in all these new rules is FHIR is the center of what interoperability is, the common language that everybody has to use. There's other processes, that the administrative process, that are very they don't work very well here in the United States, and there's some examples are the pre-authorizations. The pre-authorization process is a process where if you have a very expensive study or procedure, you need to require to the health insurance, you need to request authorization to get that procedure done, and it is covered by the health plan. And that process is done by every single payer in a different way. So what this new rule is saying, we're gonna add interoperability to the pre-authorization process, so that we can also share that information. So there's also going to be some of this that is going to be improved now, and also um, implemented using FHIR and some of the implementation guidelines by the FHIR community. So the patient data access API, as I mentioned, patient data access API, now it requires that that you share some of the clinical information and share with a third party, and share that financial information with third party. So as I mentioned before, if I am a software developer, I can create an application, and I can promote that application, and the patient can request to the health plan or to the health insurance to share his personal information, so the patient can have that information in their mobile app or in the portal or all that. So that basically allow me as a patient to have control and use the data when I need it, not when somebody else decide that my data has to be shared. No, I have control of my data. I share my data because it's my health, it's my data. So that's something that is very important. And when we talk about making the patient the center of interoperability, we also have to empower that patient to have access to their data so they can actually take control of their health. And that's why interoperability is important. It's not just a transaction of data from one point to the other, so one machine took to the other. Yes, that's the mechanical part of it. But what we do with the data is actually what it is important, and how do we use it, how we educate our patients to take control of their data. So say a patient monitor their diabetes or other healthcare conditions. That's what is really important. Is actually uh, having and getting that access to the patient when the information is needed. At the same time with the provider. So the provider access API put the information of that patient right in the moment where that data is needed. So I've seen for the last 22 years a lot of applications and a lot of advance into what software development is in healthcare. But the truth is, we've been creating a lot of silos, and we're generating a lot of data, but that data is just scattered, and it doesn't help us. So by implementing what's the provider access API, definitely we're giving also the providers the information when they need it the most to treat that patient and to improve the patient um, outcomes. So now the payers, from the financial standpoint, the payers, the healthcare, definitely, even though we see it from this point, like it is just about the patient and to improve the patient care, but also has a financial impact. So it's an industry. So how do we make this industry more efficient in a way that health funds can also um, keep that cost low so they can provide better services. And one of the things that payer-to-payer API allow other health plans is to understand that population that is coming, that new population that is coming, how do I use the data? How do I analyze this data? So basically, it's definitely what payer-to-payer actually, that part of the rule that is going to help the payers also to receive that information and use that information in a meaningful way, to not only to evaluate that patient at the risk of that patient, but also to implement programs that improve the patient care, because the healthiest the patient, the more money I'm going to make, because it's not going to use the health insurance. So there is a preventive medicine aspect of this that we need to also understand, that if we prevent a patient with chronic kidney disease, we prevent this patient to get to a stage 6 of chronic kidney disease, we're saving a lot of money for treating this patient in other ways. So that's also what we look for into, and well, that's why one of the drivers of interoperability too is not only patient outcomes, but improve patient outcomes, but also create sustainability in the of the healthcare system. So there's another aspect of this rule is what I mentioned before is the improvement prior authorization process. Right now it's a manual process. If you go to every single um, payer in the U.S., there's a lot of opportunities to improve their processes. Most of the processes require manual intervention, and they're isolated. And the information that me as a patient I have is minimal. So what uh, CMS and the regulators are actually trying with this rule is to improve this process. And again, one of the main drivers of interoperability is regulation. So that's why they say, okay, this process of prior authorization needs to be improved. Less than do implement FHIR and technology into it, so that we can actually make steps ahead in get this process in a good way. So Medicare is also saying, or CMS, a Center for Medicare Services, so it's also saying not only you're gonna implement a or mechanize or have a standard and implement FHIR in that prior authorization process, but also you're gonna report to everybody or to report to us how are you doing, what's your performance, and that's very important because for example, if you're a patient that require a CT or MRI or MRI of a high technology study, and you're waiting for 2 months to get a pre-authorization, will have a severe impact in your health. Let's say you wait 1 month or 1 week, still you're getting significant impact into and if you're waiting just for an administrative task, everybody should know, okay, this health plan is taking a month to approve this, or 2 hours, or 24 hours, or whatever. So that's why the Medicare is actually mechanizing or automating or bringing the standard and FHIR into what the rule is, because we also need to be able to measure performance of the health plans. So at the beginning, when we started implementing interoperability projects, and we built several major interoperability projects with different health plans. And one of the biggest problems that we have when we started in 2018, it was that there was no implementation guidelines, or the implementation guidelines were vague. So what CMS is doing with this new rule is that now we're actually saying, okay, these are the different implementation guidelines that we're recommending to you. So I recommend all of you that are interested in FHIR that also look at what the implementation guidelines are, because FHIR is a bunch of standards, and we will see them in a minute. But it's a bunch of definitions and profiles and that kind of stuff. But the what it tells you, what is a real life use case of FHIR, how do you use FHIR in a real life situation, is condensed into the implementation guidelines. So when you are actually going after this presentation and say you're interested in FHIR, look at FHIR as the model, but also look at as some real life scenarios, and you can find some of those real life scenarios in the implementation guidelines. So I'm not going to go over all of them, but you have some of them in how they are applied to the different parts of the rules, like patient access API, provider access API, provider directory, payer to payer, and so on. Now, what are the proposed standards? And that this is what it leads us now to talk about a little bit more about FHIR. So every single part of the rule, it it's actually pointing, or it is being defined, that FHIR is the standard that we're going to use. The FHIR release 4 is what is proposing this new rule. FHIR already have 6 releases that are being worked. And if you go to the FHIR has HO7 has a standard page that is very good, and I also exhort you to take a look at it, because you're gonna see there's works already done in release 5 and 6 They're not mature enough to go to market, but we are currently now using FHIR Release 4 in our production projects, and it's actually very stable, and it does have all that you need to implement that. That's why it's being promoted as the release that is actually will continue for the next, I think, year or so until the other FHIR Release 6 reach out the maturity level. So apart from FHIR, we have other standards like USCDI, and USCDI is basically is a US core clinical data, and basically what that defines is if FHIR tells you how you're gonna format that data, in what format, JSON, XML, what data elements, what is required, what is not required, all that information, and how to transfer that data in a secure way, and what protocols you're going to use to send that data. That's what FHIR does. USCDI is actually telling me what data, like it tells me what are the data definitions, what is immunization, so what part of the immunizations I need to share. So I think USCDI tells what, and FHIR tells how. So that's basically how I see it. USCDI tells what data I need to collect, and and FHIR tell me how do I transfer it, how do I store it, how secure I put it. So you can take a look at this more in detail, but what is important is we know that FHIR is actually here. It's not something new. It's something that started a while ago. It's been in production uh, from 2006, 2016, 17, and probably more widespread in 2018 until today. So it's used. So what is FHIR? So FHIR is a fast healthcare interoperability resources, as we have mentioned before. But why fast? Fast is because it's basically created in a way that allows us developers to build in a way. Why? Because it defines that JSON is going to be the format that we're going to send the data, and it's also telling us that we're going to use REST APIs to share the data. And it's telling us that we're going to use OAuth to manage authorization and OpenID and authorization with OAuth 2.0 and OpenID. So basically, if FHIR tells us that technical description of what we need to do to be able to develop fast applications, but also it defines a data model. So that's what it allows to actually. I don't have to worry how the database for EHR1 looks like versus EHR2, because they all now use FHIR, and the standard tells me that the patient name is always going to look like a patient name in all the other um, softwares. So basically, what are the basic concepts of FHIR? So FHIR have resources. Resources are, if you compare, or they're definitely JSON or XML documents. They're basically documents. But if you compare this to a relational database, a resource is a table. So you're gonna have in a normal application, when a relational database, you will have a patient table. When you're building a patient application, you have the patient table. So now instead of having a table, you have a patient resource, and that resource have a definition of data elements and other information. So the beautiful thing about defining every single data element or data group or data collection in resource type, uh, what that does is it allows us to then have a singular container that all the FHIR resources look alike. What is changed is what it is in actually there, but it's easy to transfer. Like for example, I don't know if you're familiar with shipping containers in the maritime industry, where before you have to have a big ship to transfer products and service products and goods. Now you can have just similar ships that have shipping containers that are similar, so it facilitates the way or the logistics to transfer things from one place to the other. The same thing is FHIR resources. So basically, that FHIR resource is that shipping container that we're using to transfer the data from one place to the other. Then we have APIs, and basically what we're saying is that we're going to be one of the things that FHIR standard has is define that you're going to use API REST APIs in the way that you transfer data. So basically, you can access any resource or FHIR resource using a HTTP command, put, post, get. So that's what it makes it easy for you to develop because, as you know, we've been using HTTP and REST for a while now. So it's a common language for us, and that's why it also makes it fast for us to develop applications because we all know what a post or a get or a put. So we understand how to talk about. So now FHIR HL7 decided that now let's make this modern and that can grow and keep evolving. Let's implement RESTful as the way that we transfer data from one place to the other, and also say, okay, those resources that has the data, they're going to be formatted in JSON or XML. There's other formats too, but as one of the panelists also said before, JSON is what it has been implemented everywhere. I haven't seen an implementation of FHIR using XML so far, but I guess it will have its uses at some point. And then the data elements, what's required. There's some profiles and stuff that you're gonna see. So what are the advantages of FHIR? So flexibility. We can implement an application. We can create applications in very easy, but also the flexibility of the resources. I don't have to create, for example, before in a relational database or in a HL7 segment, there was some predefined fields that I need to have for my use case. In FHIR, I can define what is going to be in that particular resource. So it gives me flexibility to add and to create and extend those FHIR resources. Easy to use because we're used to, as developers, we're used to work with HTTP, with with JSON. We're used to create, so it's definitely create some easy to use, so making it more scalable, and also it definitely help us uh, to implement. So what is HL7? Because one of the important things is, okay, who maintain the FHIR, like who keep the FHIR alive. So that is HL7. HL7 is the entity, is the organization that is being responsible for developing not only FHIR but other standards in healthcare very successfully. It's a combination of different entities from the private sector to the public sector, and they are definitely the ones that are keeping those standards. I exhort you to go to HL7 website, and you're going to see their different standards, including FHIR. So they are the ones responsible for it. So if you need to know and you're curious to know how FHIR is actually implemented, go to the FHIR to HL7 websites, and you're going to find everything that you need in there. One of the things that also I want to mention you is that there's a lot of documentation for FHIR. There's a lot of things that you can actually starting to understand from the technical standpoint and from the clinical standpoint. If you're not a developer but you're a clinical person, I also tell you you should start looking at what FHIR is, at least understanding the basic concept. So when somebody say yell FHIR, you don't start running, and you know that it's a healthcare standard and not that something is burning. So if everybody needs to understand what FHIR is and what how to use it. As a matter of fact, we the one we that use mobile phones, and everybody, I'm sure you do. you actually have a FHIR implementation in your phone. If you're using Apple, all the healthcare information, all the health information and activity on your cell phone is basically structured in FHIR. So the best example that you have about interoperability, go to your health app in the Google Health in Google and Android or in the iPhone. You're gonna see you already are using FHIR. That data that is stored there is already starting FHIR. As a matter of fact, Apple in Google and all the different markets, they're one of they're promoting, and they're one of the organizations that that are investing the most in FHIR and making it easy to do. So um, there's some case studies like how do we implement the FHIR? We have implemented FHIR with electronic health records using population management. Population management is one of the use cases that it is more important. For example, in the case of COVID, you were able to define or to understand and have and analyze the data from different places. Imagine if you have all that data in one format that everybody can use and understand. So that's very important. But also for us to analyze and um, data in a whole population setting, clinical decision support, patient engagement, and clinical research. Those are all use cases that we're seeing in the patient engagement, from an appointment reminder to your patient portal to encourage that patient to follow guidelines and all that. That's very important. Clinical research, how we were empowering now researchers to, instead of having to use some files, and we can actually give them a repository of data where they can actually use it in a standard way so they understand what the data models are. So that's very powerful. So I'll say thank you to you guys. I know there's a lot of information. I know that there's many people that talk about FHIR and all that. But I think, and the most important thing that I want you to understand, interoperability is much more than technology. Interoperability is the way that we tell that patient story, and we as healthcare professionals, as we are, because not we are developers, but we are actually helping helping patients as well. So we're also healthcare professionals, and we have to see it as more than just technology. It is more. We are all patients, and what the main goal of interoperability is to be able to tell that patient story to whoever needs it and whoever is going to treat this patient later.